Last year, in the middle of the COVID-19 pandemic, overdose deaths rose to a new high of 93,000, according to the U.S. authorities. This figure surpasses the previous year's high of almost 72,000 drug overdose deaths, representing a 29% rise. According to the Associated Press, this is a catastrophic loss of human life. He went on to say that the country was already dealing with its greatest overdose epidemic, but COVID has considerably aggravated the situation. Experts say that lockdowns and other pandemic restrictions isolated drug addicts, making therapy more difficult to obtain. The Centers for Disease Control and Prevention analyzed death certificates to predict the number of drug overdose deaths expected in 2020. Overdose deaths are estimated to number around 93,000, which equates to more than 250 each day, or 11 per hour. In recent years, prescription painkillers have been overtaken by heroin and subsequently fentanyl, a dangerously potent opioid, which previously drove the nation's overdose crisis. Fentanyl was created to alleviate severe pain caused by diseases such as cancer, but it is increasingly being sold illegally and mixed with other substances. This increasingly poisoned drug supply is really driving the spike in overdoses, said Shannon Mona, a Syracuse University sociology professor. According to Mona, there is no evidence that the number of Americans who began using narcotics increased last year. Rather, the additional deaths were most likely caused by persons who were already addicted. Some people have told her research team that evictions were halted and unemployment benefits were prolonged, which resulted in them having more money than usual. "When I have money," they told her, "I stock up on my drug supply." The increase of 21,000 people is the largest year-over-year increase since the count increased by 11,000 in 2016.